Greetings, everyone. This is Miss Gibson. So, this is lecture 3, and it's going to be going over cancer medications. So, the first thing we're going to go through is the classes. While considered a chronic illness, cancer has thousands that live 5 years or longer, while 68% are cured. They may have exacerbations and remissions throughout life. Regardless of treatment, cancer has a negative impact on physical as well as psychological functioning and quality of life. So, chemotherapy, this is treatment of cancer with chemical agents used to cure and to increase survival time. Has some selectivity for killing cancer cells over normal cells. More cytotoxic to cells that divide rapidly, such as skin, hair, and the blood-forming cells. Tumors with rapid growth are often more sensitive to chemotherapy. It's useful for metastatic cancers since it is systematic. Chemo is given on a regular schedule called dose-dense chemo for maximum benefit while reducing side effects. Frequent side effects of all chemo is alopecia, which is hair loss, leukopenia, which is a reduction in white blood cells, neutropenia, which is a reduction in neutrophils, which are a type of white blood cell that make up 70% of the total white blood count. They're major fighters of infection. Anemia, which is a decrease in red blood cells. Thrombocytopenia, which is a reduction in platelets. And then stomatitis, which is an inflammation of the mouth. Treatment issues, drug selection based on sensitivity of cancer cells, stage, extent of disease, as well as the dosage calculation can also be an issue with preparing the medication. Patient and family education is critical. IV is the common route given, but it can be given intrathecal, which is spinal through the spinal canal, intraventricular, which is the brain ventricles, and then through the intraperitoneal, which is the abdominal cavity. My goodness, the abdominal cavity. Can also be topical, and then there's also an option to give it intra-arterial, which is through an artery to the liver. The oral chemotherapy medications, they are just as toxic and should be handled with care. So the first drug class for chemotherapy we're going to talk about is alkylating agents. So alkylating agents are a major class of chemotherapy drugs used in cancer management. They work by adding alkyl groups to DNA, causing cross-linking and strand breakage that prevents cancer cells from dividing. Some contraindications would be pregnancy, myelosuppression, liver and kidney dysfunction. Interactions would be if you're going to be given SUX, which is a paralytic agent, or if you're on furosemide, it's just a couple interactions. You want to make sure that your patient has adequate fluid intake. You're going to monitor for blood in the urine, monitor for bleeding and infection. You're going to monitor their CBC, their uric acid level, and liver enzymes. You're going to administer an antiemetic as needed, give good oral care, do education on them doing good oral care. Make sure that they're on a contraceptive. Make sure they are taking contraception. Check to make sure they're not having difficulty hearing, because some of the alkylating agents can be ototoxic and in form of infertility risks. Next is antimetabolites. These are a class of chemotherapy drugs that mimic natural molecules needed for DNA and RNA synthesis. It tricks cancer cells into using them instead of the real building blocks. This disrupts cell replication and leads to cancer cell death. They are widely used in treating leukemias, lymphomas, breast, colorectal, pancreatic, and lung cancers. Some complications would be bone marrow suppression, GI side effects, renal damage, reproductive toxicity. Contraindications would be pregnancy and lactation, renal and liver dysfunction. Some interactions would be aspirin as well as folic acid, your PPIs, allopurinol, and warfarin. You're also going to make sure they drink plenty of fluid, administer sodium bicarb to alkalinize urine, ensure they're on contraception, avoid alcohol, monitor for bleeding and infection. You're going to monitor their labs, do a good I&O, monitor for jaundice, administer antiemetics, and provide education on good oral hygiene. With the good oral hygiene, you also want to make sure that any mouthwash that they're not using any with alcohol. The alcohol can be extra drying to the oral canal or oral cavity. Next is antibiotic agents. These are a class of chemotherapy drugs that inhibit cell division, which is called mitosis, by interfering with microtubule dynamics. Microtubules are structural proteins that form the meiotic spindle, which is essential for spreading chromosomes during cell division. By disrupting microtubule assembly or disassembly, antibiotic agents arrest cells in the M phase of the cell cycle, leading to programmed cell death. Some complications would be peripheral neuropathy, alopecia, bone marrow suppression, as well as bradycardia. Contraindications would be pregnancy, liver disease, neuromuscular disease, immunosuppression. Some drug interactions would be digoxin, phenytonin, calcium channel blockers, beta blockers, NSAIDs, and anticoagulants. Nursing considerations, you're going to assess for neuropathy, monitor liver enzymes, monitor for bronchospasm. They want to avoid cold air as well as cold beverages. Monitor for bleeding and infection. You're going to monitor the labs. Administer an antiemetic as needed. Give good oral hygiene. They want to avoid any toothpaste as well as mouthwash that has alcohol in it, and make sure that they're on a contraceptive. And as you can tell, most of these drugs are going to have the same nursing considerations for each one. Next is anti-tumor agent. This is a major group of chemotherapy drugs derived from streptomyces, bacteria that bind directly to DNA and interfere with its function, preventing cancer cells from growing and dividing. Unlike traditional antibiotics used for infection, these are specialized agents designed to fight cancer. So some complications would be bone marrow suppression, GI side effects, alopecia, cardiac toxicity. Contraindications would be pregnancy and immunosuppression. Some drug interactions would be calcium channel blockers, phenobarbital, phenatonin, and use caution with the phenatonin. You nursing consideration, use cautiously in liver disease. Monitor for bleeding. Of course, you're going to monitor the labs. Monitor for cardiac dysfunction. Administer antiemetics, and then your good oral hygiene. Next is your topio isomerinase. This is it's a chemical therapy agent that blocks the activity of topoisomerase enzymes 1 and 2, which normally help unwind and regulate DNA strands during replication and transcription. By inhibiting these enzymes, the drugs cause DNA strands to break, preventing cancer cells from dividing and ultimately leading to cell death. Some complications would be bone marrow suppression, GI discomfort, alopecia. Your contraindications would be pregnancy and myelosuppression. Some nursing considerations would be monitor for bleeding and infection, monitor your labs, give antiemetics, your good oral hygiene, and make sure they're on a contraceptive. Other agents and combinations, miscellaneous would be chemotherapy drugs with mechanisms of action that are either unknown or do not fit another category. Combination chemotherapy given more than one drug in a timed manner may be more effective yet increases side effects. So you could have an increase in GI discomfort, hypersensitivity, central nervous system effects, liver and pancreas toxicity, renal toxicity, bone marrow suppression. Your contraindications would be pregnancy, if they have pancreatitis or any liver or kidney disease, or myelosuppression if they already have that. Interactions would be methotrexate, prednisone, anticoagulants, any central nerve system depressants, MAOIs, and alcohol. So, oops, I skipped one. So next we're going to talk about immunotherapy. The first one is your biological response modifiers, or BRMs. These are agents that enhance or restore the body's natural immune system against cancer. Instead of directly killing cancer cells like traditional chemotherapy, BRMs modify the host's biological response to improve recognition and destruction of tumor cells. They are part of immunotherapy and supportive cancer treatment. Your monoclonal antibodies, these are laboratory engineered proteins designed to recognize and bind to specific antigens on cancer cells. By attaching to these antigens, they can either directly kill cancer cells, block growth signals, or recruit the immune system to destroy them. Your hormonal agents, also called endocrine therapies, are drugs that block, suppress, or mimic hormones to slow or stop the growth of hormone-sensitive cancers. Certain tumors like breast, prostate, and endometrial cancers depend on hormones such as estrogen, progesterone, or testosterone for growth. By interfering with these signals, hormone agents reduce tumor progression. Side effects of all is masculinizing effects in women. I don't know why I struggle with that. Forgive me. Feminizing effects in men. So next we're going to move into, we're going to go more in depth with the biological response modifiers. As we've already discussed, they modify the patient's biologic response to tumor cells. It helps the body to recognize cancer as foreign, so immune system will destroy. And it helps to improve immune response to repair and replace cells damaged by cancer treatment. BRMs is cancer treatment. You have interleukins. These are substances the body makes to help regulate inflammation and immunity. It helps immune cells recognize and destroy abnormal body cells. In other words, it charges up the immune system. Then you have interferons. These cells produce proteins that assist cancer therapy by slowing cell division, stimulating growth and activation of natural killer cells, introducing cancer cells to resume a more normal appearance and function, inhibiting the expression of oncogenes. Some side effects of BRM therapy, your interleukins, generalized and severe inflammatory reactions, fluid shifts, or tissue swelling that can affect organ function. Some contraindications would be pregnancy, hypersensitivity, suicidal ideation, pancreatitis, liver and kidney disease, pulmonary disease, and diabetes mellitus. Some interactions would be theophylline, can cause cardiotoxicity, neurotoxicity. You don't want to give any live virus vaccines because it could cause neutropenia or thrombocytopenia. Next is our monoclonal antibodies. Combine actions from immunotherapy and targeted therapy to help treat specific cancers. Your monoclonal antibodies are hybrid cells that bind to target antigens. They affect cell division and make cells more sensitive to chemotherapy. Complications would be infusion reaction, rash, hypotension, wheezing, flu-like symptoms, or tumor lysis syndrome. Some contraindications would be pregnancy, hypersensitivity, liver and renal failure. Some drug interactions would be hypertensives and sun exposure. Next is your hormone agents. They block testosterone. Some complications would be hot flashes, decreased bone density, dysrhythmias. Contraindications would be pregnancy or liver disease. Nursing considerations, you want to administer calcium and vitamin D, monitor for dysrhythmias, and monitor PSA. They're also one of them, the tamoxifen. I have a hard time saying that one. I have to sound it out. Is an estrogen blocker for breast cancer. Get tongue-tied. Some complications for this would be other female reproductive cancers, hypercalcemia, nausea, vomiting. It does increase your risk for pulmonary embolism, hot flashes, as well as vaginal bleeding. It does have a drug interaction with anticoagulants and SSRIs. Some contraindications would be pregnancy, warfarin if you have a history of PEs, and heart disease. So your next slide is nursing implications for anti-neoplastic meds. I'm going to let you guys read through that. Then I've also provided you guys with patient teaching for anti-neoplastics, as well as cancer management for the colony stimulating factor. This is supportive to chemo. It affects cellular regulation and stimulates recovery of bone marrow cells, which will improve immunity. Patients have improved adherence to chemo schedule due to less suppression of bone marrow. You could also the patient may also be given an order for erythropoietin. This is red blood cells, granulocyte colony stimulating factors, and then your interleukins, increased growth and activity of T cells as well as B cells. So this slide is just supportive to chemo. You just need to know that those might be ordered along with the chemotherapy. And that is all. Please make sure you check out the extra resources that will be uploaded as well that'll help you with these medications. If you have any questions, don't hesitate to send me an email. Thank you.